and here we are again, Let's Talk, a podcast series brought to you, as always, by Hazelden and Betty Ford. And as always, I'm your host, William C. Moyers. We're glad you're with us today. And today I'm joined by Kevin Doyle, the president and CEO of the Hazelden and Betty Ford Graduate School of Addiction Studies. Welcome, Kevin.
Great to be here, William. Thank you for having me.
Right off the bat, it begs a question. How did you get here and where does your interest come from?
Hazelden and Betty Ford were known to me when they were separate, before the merger. I'm not even sure I was aware of the merger, but I've been an addictions counselor for over 3 decades.
Wow.
And so I think my first exposure to Hazelden was ordering materials through our publishing division and things for clients or patients to use. So I always knew the Hazelden name back in the 1980s, I guess. And then everyone knew about Betty Ford, and at some level I was aware of the merger, I suppose. But I didn't become aware of the graduate school until much later. And long story short, advanced through my addiction counseling career into academia, was in a department chair role at a university in Virginia, felt as if maybe being a dean would be something good for me. And I happened to see on a listserv the notice of the opening here, became the dean last January, and now moved into the president role just recently. So long journey, but really pleased to be here. And the second part of your question is sort of what drew you in. And as I've said to you and others before, I happen not to be a person in recovery myself, but early on in my counseling training as a master's level student, I started to learn about recovery, and I got hooked in by the stories, the stories of transformation and recovery, and seeing people, and I worked with adolescents, seeing them turn their lives around and become contributing adults, and sometimes even return to work in the field, was really inspiring and impressive to me. And I think I said, I want to be part of that. And so that's where my journey has led me.
And we're glad that you are part of it now as the president and CEO. There was a time when counselors were people who were in recovery themselves. They, didn't necessarily have any academic background. They may have not even had a high school education necessarily, but things have changed. Why have things changed, and why is that important?
And that's how it was when I started. My first job in the profession and in inpatient treatment was in the mid-1980s, and most of the workforce then were people in recovery. And yet many of them were only drawing upon their own recovery experience. And we don't do that for any mental health disorder, any physical health disorder. There's training that goes along with how to do this right, how to do this safely, and how to do it well. And so I experienced seeing folks who had the personal passion, adding to that the training, and you produce some tremendous people, and that combination is really powerful. So I've always felt a little bit left out, and sometimes we'll say, gosh, I wish I was a person in recovery, and many of my friends in recovery say, no, you don't really want to have to gone through the addiction side of it, just advance right to recovery. But that combination is really powerful, and now seeing many of our students are personally in recovery, many are not, but they're getting the tools to be helpful for the folks who are going to be needing this for many decades to come.
And of course, it's not just that the academic standards have risen for counselors because of what we're learning in the science of addiction and the treatment of it, but regulatory agencies and insurance plans, they kind of expect it, don't they?
That's exactly right. Counseling is no different from any other healthcare profession.
Right.
That there's a body of training that you go through. There's credentialing, there's oversight, there are accrediting bodies, licensing bodies, regulatory boards that oversee safe practice. And what the hallmark of all those things is public protection, patient protection, making sure that the services that are being delivered are safe. And so that's certainly something that we ascribe to and support. We are an accredited graduate school by the Higher Learning Commission, for example.
Why is that important to be accredited?
Well, it's a seal of approval, and anyone could just hang a shingle out and say we are this, and there's no external review. And so that is important to make sure that you're engaged in a continuous process of improvement, gathering data, looking at outcomes, making sure that what you're doing is consistent with best practices in the field, whether it be education or healthcare. And ours is a little bit of a combination of both.
That accreditation is also important financially because it allows students to gain scholarships.
That's right, and federal financial aid
federal financial
in
aid.
particular. Right.
Yeah,
yes.
Thank you.
Right.
So let's talk about what's happened. Our graduate school was born, I think, in 1999, a long time ago. I was with the organization at the time. It was a small little appendage over here, but it's now been really integrated into the mission of the organization. Then here comes the pandemic. and here comes all the stresses of addiction and mental illness. How has the graduate school adjusted to the realities of this pandemic the last couple of years?
I think we've done very well. Like other institutions of higher education, we needed to pivot, and I was before I arrived here, but a lot of counselor training programs, really all of higher ed, had to adjust to providing some online content, whether it be synchronous or asynchronous. But one of the things that we did back in 2015, I think it was, 2014, was to start our online program. So we already had an online program, asynchronous learning for people around the country, around the world, well, primarily around the country, who could do their learning from home. So a lot of our students were not really impacted that much because they were already doing online learning. We bring those students to campus twice during the course of their degree program. So that became virtual too. We did that synchronously in a virtual manner. I'm really pleased that starting this summer, June of 2022, at this point, it looks like we'll be able to bring our students back for their on-campus residencies. But we gradually return to the in the classroom learning as well, with masks and distancing and all those precautions that we have to take during the pandemic. And again, all of us are looking forward to that gradually going back to reality. I teach a class on campus on Saturdays, for example, and it's amazing how much you miss when students have masks on. You know, the facial expressions and some of the nonverbal things. It's great to be in the room with them, but we're still not quite where we'd like to be.
I'm sure, though, even though their mouths are covered, you can see their eyes and they're staying awake for your lecture.
I hope so. I do allow coffee in the classroom now, so yeah.
So the other thing that's changed in the graduate school is that in the old days of the graduate school, you would come and you'd get a Master of Arts in Addiction Studies. But the menu of opportunity is much broader now.
Not too much broader. The degree label's the same. That is what we call it addiction counseling, not addiction studies.
Okay.
But it's 60 credits, whether you be on campus or online. And the reason for that is most state licensing boards, nearly all really, have set the standard of 60 graduate credits for independent licensure. And so we want to make sure, because we have students from all around the country, that students can become licensed as counselors. Not every state licenses addiction counselors, but half do. Okay. Some have specific licenses for addiction counselors, some don't. Many of our students go on for credentials like licensed professional counselor, licensed clinical counselor, licensed clinical mental health counselors. There's not as much universal language for counseling as there is, for example, for social work. Most of all of them are licensed clinical social worker. There's more variability in counseling. Some students are very clear. They want to be laser focused on addiction counseling. Others want maybe a little bit broader license. And we also know, of course, that addiction doesn't happen in a vacuum. Patients and clients bring mental health diagnoses and all kinds of other challenges to their recovery process. So our training program, our education encompasses being able to look at those things also.
So when we talk about students, I remember when I came, I did a guest lecture one time. I walked in and I hadn't been on a campus in a long time. And the thing that struck me immediately, and this was before the pandemic so I could see everybody's faces, was that not everybody who was a student was young. At least young. That's as right. I saw it. Talk about that.
Yeah. Our average age is 41.
41.
And one of the terms that you'll hear, and we hear at our school, is career changers. People who may have been, we've had lawyers, we've had accountants, all kinds of different professional careers that individuals come from. Sometimes they have that transformational recovery experience that leads them to do some self-reflection and say, this is something I'd like to be part of in my sort of second half of my career. Other times they've been a helping professional, a teacher, or what have you, but because of the way licensure works in healthcare, a bachelor's degree is often not enough to do the kind of work that you really want to do. And so payers, accrediting bodies, the folks who oversee the work that we do often are looking for that master's degree. And so we could have someone who started out at the bachelor's level and moved on to the master's level.
You talked about accreditation, and one of the important features of it is that it allows students to get low-interest student loans, federal loans. How else do people pay for graduate school at the Hazelden Graduate School?
Well, it's a great question. Some of them are just highly invested themselves, and they may have come from a background where they have the ability to pay themselves through their savings. But we're really thrilled, and one of the things that does distinguish us from a lot of other master's programs is that we do have a lot of scholarships. And so recently we've had some tremendous, generous generosity from donors who have provided scholarships. It's always good, the phrase you sometimes hear is skin in the game, for students to have a little bit of investment.
Of course.
And so that we don't typically provide a full scholarship, but it can be a really dramatic, make a very dramatic difference for people if half of their tuition is covered by scholarship dollars. And so we have scholarships for students of color. That's the definition that one of our donors was interested in. We're rolling out a specific scholarship for Hispanic students, that label of students who identify from Hispanic or Latinx background. We have some for students who are from Canada, and then some that are just more broadly based for students who just don't have the ability to pay fully themselves. And so that's a little bit unusual at the master's level.
Yeah. Kevin, diversity, equity, and inclusion is a major initiative within Hazelden Betty Ford, and no department, no division is excluded from that focus, that emphasis. How is the graduate school addressing diversity, equity, and inclusion?
Yeah, I'm glad you asked me that, William, and we could talk for an hour about that, so I'll try and hit a couple of basic principles. Within the counseling profession, multicultural counseling or cross-cultural work has been a priority since the 1990s and before. So this is ingrained into the preparation and training of counselors. So this is not new to us as counselors, and that's a requirement many state licensing boards have, that you have to have at least one course in that. So it's really been a priority for the counseling profession for a long time, and so I would probably start with that. Within Hazelden Betty Ford, we participate very actively as a graduate school in our DEI initiatives. We have faculty representation on our Diversity, Equity, and Inclusion Committee. We formed a really strong partnership with our DEI director, Andrew Williams, who's probably been one of your guests. Andrew has a background in higher education as well, so he's been a tremendous partner for us. Our staff our faculty and staff continue to go through all the trainings that we're doing. So we're, I would say, more than just a willing partner. We want to be a leader in this part of our organization. So it's really significantly important to counselor training programs to do that.
And of course, our graduate school also has an international reach. Do we get students from around the world that come?
We do. It's an area that we really would like to do more of,
Yes.
though. You have to go through a very involved approval process to offer online programs in other countries.
Okay.
So primarily, our students have come to us here in Minnesota in the Center City campus from those other countries, from the Netherlands, from Iceland, from Canada in particular, Mexico, but they have come to us. We would love to be able to come to them through the online program and are trying to look at ways to make that happen, but it's an involved process. So right now, those folks come to Center City and take their classes here on campus.
You know, it's interesting when I get queries about becoming a student or applying for the graduate school, it's to be a student. But lately I've had several people reach out to me from across the country and say, how do you get to be on the faculty of the graduate school? And I haven't really had a good answer for them except talk to my colleague, Kevin Doyle. How do you recruit faculty?
Well, we have two things, I guess I would say. We just hired 2 new faculty this week. And we did a national search and got a tremendous pool of applicants.
Great.
For an institution such as ours to be a full-time faculty member in a counselor training program, you really do have to have a doctorate, particularly in counselor education would be the priority. And so we did find candidates who met that. And we're really excited for the 2 of them to join us. So that will give us 6 full-time faculty members, not counting myself, so 6 folks who are focused on teaching the classes. We do use a fair amount of adjunct professors, though, too, and that's where we can be a little broader. We have some social workers, we have Dr. Steve DeLisi, a medical doctor, we have some psychologists as well as counselors. So we have a multidisciplinary team of adjuncts who teach as few as 1 class a year, as much as maybe 1 or 2 classes a semester, depending upon what they do. And they bring really good, different perspectives. Not all of them. Some of them are Hazelden Betty Ford employees who work on our treatment units, but some work at other institutes. Like we have one person who works for the VA. Brings that nice perspective about veterans, and others who are just in various places around the country. So the how would be watch for an ad when we're recruiting, or reach out to me if there's that interest. And then the big question, of course, is, do you want to teach in person on campus, the so-called old-fashioned way, or do you want to teach online? And those are 2 pretty different things.
Kevin, we have about 2 minutes left. I wanted to ask you the future of the graduate school. Where do you see it going in the next 2 to 5 years?
Yeah, higher ed is in a really interesting time right now with the
Yes.
Great Resignation and all of the things that are happening. I think what we have kind of going for us is that many people are looking for meaning, meaning in their career, meaning in their lives, and it's not hard to find that when you're working with people who have life-threatening substance use disorder. So I think that bodes well for us, and unfortunately the opioid crisis, the epidemic crisis that we're facing, indicates that we're going to have a tremendous need for counselors, and the job outlook for counselors is very solid.
Yes.
So we need people to help in this crisis. But I also think that students are looking for more and more flexibility. And so right now we essentially have two choices. You come to Center City and sit in the classroom, or you are asynchronous learning wherever you are. But what about a synchronous time where because students apply for our program and for the online program, and they'll say, what time is class? And we'll say, asynchronous means you're doing your work at 2 o'clock in the morning, that works for you. But are there people out there who would like to learn, don't want to move to Center City, but can make themselves available from 6 to 9 p.m., whatever time zone they happen to be in?
Right.
So I think that's something we'd like to start looking at too.
Yeah. Last question before we go. What happens to most of the students who earn their degrees at our graduate school? Where do they end up working, or what do they end up doing?
Yeah, a really significant percentage of them come to work for us.
Oh, really?
The last data that I saw was, I think, 42% over a certain period of time chose to continue working for Hazelden and Betty Ford, which of course we love.
Yes.
We're not a training institute for Hazelden and Betty Ford. We are a degree granting institution. But if you do your internship in a Hazelden and Betty Ford program, and that's a big draw, a lot of our students do that, and they feel comfortable there and see the work being done, then it's logical that many of them will stay with us. However, we love training people who go to work anywhere because there's such a need. And so people tend to work in residential or outpatient treatment programs close to their homes.
Yeah.
So if they're a student from Mississippi, then they'll be part of the workforce in that particular state, for example. But with our geographical reach at Hazelden and Betty Ford, Oregon, Washington, California, Minnesota, Chicago, Florida, all the places we have programs, I venture to say we have graduates working in all of those places too.
Yeah.
And then the last thing I'll say, William, is that we have had some tremendous leaders grow out of our grad school that are now moving into very significant leadership roles within Hazelden and Betty Ford.
Cool.
And I'd leave some out if I started to name them,
Yeah,
but
right,
they've
right.
moved into really significant
Yeah.
positions within our organization.
Yeah. What I love about that is the fact that our graduate school is planting seeds of experience, seeds of academia, expertise, not just within our system of care, but in treatment centers from the Salvation Army to for-profit, not-for-profit, and in agencies all across the country and around the world. So the mission of Hazelden and Betty Ford is being spread through the good work of the graduate school.
That's exactly right. We had a virtual open house yesterday, and one of our grads who was our alumni who was on there is employed by the Salvation Army and was talking about the work that she's doing there.
Yeah, I've run into somebody there too. So thanks for the good work that you and that incredible faculty and that team at Hazelden and Betty Ford are doing in the graduate school. Kevin Doyle, the President and CEO of the Hazelden and Betty Ford Graduate School of Addiction Studies, thanks very much for being with us today.
Thrilled to be here.
And thanks to all of you for tuning into our Let's Talk podcast. My email address, if you have any criticisms or questions or concerns, is wmoyers@hazeldenbettyford.org. Remember, from academic higher ed to prevention and research to treatment, recovery, advocacy, and resources for the community, Hazelden and Betty Ford covers it all. So tune in next time for Let's Talk. We'll see you then.